All right, part 2 of our case raised yesterday. We talked about the breast, and today I want to talk about the rhinoplasty here. Now, in this case, our patient had 2 previous surgeries, and we did a third rhinoplasty, a third revision on her nose job. And with these secondary or tertiary surgeries, what happens is, because of the first or second or previous surgeries, most likely the cartilage in your septum, the middle wall of the nose, the cartilage there is probably harvested for the previous surgeries. Now we need that cartilage because when we do the rhinoplasty, we take excess cartilage to give shape, but also we use the cartilage that we take and we put it in specific regions, areas, and use them as support for the nose, like building a house. Without them, the nose will collapse. So we need to put in cartilage, and we also need to take out cartilage for the primary cases. Now, with these secondary cases, depending on the deformity, you might do a lot of different things, but you would need some cartilage to build. And if the nose doesn't have it, you gotta have it harvested from somewhere else. Now, the options are back of the ear or the rib. Now, back of the ear, here is a round cartilage, the area that we take the cartilage. So it's a round elastic cartilage. So it just reforms to that round shape. Now, you don't want your nose to be round or doing an S or C shape, so you want the nose to be straight. Then you need straight cartilages, and a round concave cartilage is not going to do that. We can use that for either the tip or alar grafts, but apart from that, this is not our first choice. It's the rib. For women, we make a little incision under the breast. For men, we just do it in the chest, so women are a bit more lucky. We can hide it in the IMF, inframammary fold. But with this case, even better, I was able to hide it completely because I was already doing a breast lift augmentation. So I was already opening up the breast, and it was under the muscle. So here, under the pectoral muscle, we have the ribs and intercostal muscles. So the plane is actually where the rib is. So the pocket, after opening it and before finishing breast, I just took the cartilage, so our patient didn't need an extra scar to harvest that. And then we slice up the rib, and we use it for support for grafts, for the midline, for the tip, for columella, and we also do diced cartilage. We dice the cartilage into very fine pieces, almost making it like minced meat, minced cartilage. And then we use it like a paste in especially the dorsum of the nose, where we need to give shape. It covers the top, so it covers the little imperfections, creating a smooth and a delicate thin dorsum, and gives that nice narrow dorsum shape. It's always a surprise with revision cases. It could be very easy, it could be extremely hard, and you never know till you open it up. But it's always a challenge, and it's always fun to finish that challenge. So thank you for watching.